Hi, my name's Josh. I'm the Director of Osteopathy here at Attune. Welcome aboard to all those who are joining us. Hopefully today I can enlighten you a little bit on osteopathy as a profession and how osteopaths work here at Attune. First of all, I'll give you a brief history of osteopathy. Osteopathy dates back to the late 1800s. Dr. Andrew Taylor Still first developed the manual techniques that we still use today. Dr. Taylor grew disillusioned with the medical practices of his time, and he developed a new philosophy surrounding removing restrictions and dysfunctions from the human body to help it function more healthily. Over time, through the 1900s, there were schools of osteopathy that opened in Europe and the UK, and in the late 1900s, in the 1980s, osteopathy came to Australia, and universities started offering the course here. To this day, there's three osteo courses available in Australia, and we produce 150 to 200 graduates per year. So how does it work? Osteopathy is a manual form of medicine. Osteopaths treat and assess the body as a whole functioning unit. So we consider the body systems, the musculoskeletal system, circulatory system, nervous system, muscles and tissues, all functioning together as a healthy unit. In our assessments, we look at how the body is sitting in its symmetry, so we're looking for changes of alignment in the body, and we're also assessing for loss of range of motion or asymmetries in range of motion in the body. We also look for changes to tissue texture. By piecing these key information together, we're able to come up with our diagnosis and formulate treatment plans from there. Treatment-wise, we use a range of manual techniques. Techniques can be divided into direct techniques, which address a barrier or restriction, such as soft tissue massage or manipulation. Stretching is also one of these techniques. So we're just doing some mobilisation technique here, just some articulation. Yep. So this is circumduction of the hip articulation. This is an MET technique. Just push towards me. Let it go. Go again. Push. Let it go. Go again, push, let it go. This is MET for the neck. Okay, turn your head to the right for me. Stop. Go again. Stop. Good.
This is a HVLA, just so Jake knows.
HVLA manipulation. We also have a range of indirect techniques where we treat the body in a position of ease, where a tissue is relaxed. These techniques include myofascial release, counter strain, and craniosacral technique. This is myofascial release. This is craniosacral technique. Osteopaths will often prescribe home-based management strategies. These may be lifestyle advice, or they may revolve around strengthening or stretching exercises. And the goal of these exercises is to consolidate what we do in the treatment room itself. So, who needs to see an osteopath? What are our most common clients? Well, we treat everyone from newborns and infants all the way through to geriatrics. Our most common newborn presentations include reflux, constipation, digestive concerns, colic, head-turning preference, plagiocephaly, failure to thrive, and in older children, growing pains and scoliosis. In adults, we treat both acute and chronic conditions. These may include, but are not limited to, headaches, neck pain, back pain and arthritis, repetitive use injuries such as tennis elbow or plantar fasciitis, and as well as acute sporting injuries. You don't need a referral to see the osteopath. It's just a private clinic service with normal bookings. So what does osteopathy look like at Attune in particular? We have a varied range of osteopaths at the clinic. Osteopaths do have subtle differences to the way they treat. Some will use more direct and some will use more indirect techniques. Osteopaths also have different preferences in the age brackets and type of conditions they will treat. There's a lot more information available on that at reception, but on the whole, osteopaths at Attune provide a well-rounded service catering for all clients. So one of the most common questions that we get is, what is the difference between a physio, an osteo and a chiro? I've done a more detailed detailed video on this, which the link will be provided for. But in basic summary, osteopaths are primarily manual medicine practitioners, meaning that we do a lot of work with our hands throughout the course of management. We do also prescribe some home-based exercises I mentioned earlier, but the weight of our treatment is in what we do in the room itself with our hands. Physios tend to weight a little bit more heavily towards home-based exercise and rehab. That is probably one of the most common questions we get asked as a professional. And it's certainly good for you to understand in terms of your referral to us and who to refer to when. Finally, I'd just like to talk to you about how our osteo department fits in at Attune as a whole. We really enjoy working closely with the other health professionals, particularly helping physiotherapy clients achieve their goals for rehab. By removing restrictions and improving range of motion, we're able to facilitate a rehab program with a physio. We do a lot of work with Buteyko and breathing clients to improve diaphragm and rib function. And a lot of chronic overuse injuries. We help with chronic pain clients who might be getting psychological treatment or seeing the GP. We refer closely with podiatrist, helping with hip and low back mechanics to help clients adjust to any measures that have been taken to change their foot structure and alignment. And we really enjoy working closely with all the professionals and have a very open referral basis within Attune. By all means, if you see any of the osteos, you'd like to discuss anything about our profession or any clients that you feel might have some benefit from osteo, then by all means, just talk to us and get to learn a little bit more about what we do.